Good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, joined with Dana Hawkinson today. We're so happy to be back with you. We're broadcasting live from the Dulles Simons Jr. Family Studio. This is the best. It's a wonderful day today because what is today, Dana? Opening day at the K. Opening day. So I wore a special tie just for Vince Key. I want to show him that he's not the only one out there that's wearing the cool Royals shirt. Yes, Vince, you're live with us today. Team doctor for the Royals. One of our outstanding orthopedic surgeons who's laughing at me. I'm sitting here today being able to raise my arms because of Vince Key, who's repaired both of my shoulders because I try to be an athlete from time to time. By the way, there may be a little special presentation tonight at 6:35 on the Royals pregame show. I think we're better than Fauci.
It's
what do you
phenomenal.
Think, Bach?
Yeah,
it's
absolutely.
so much better. We want all of our listeners out there to take a vote. Let us know who's got the better first pitch, Fauci or Stites and Hawkinson.
Yeah.
Because I'm just going to say, Fauci did set a very high bar. But smart man, don't think he can throw a baseball. But thanks to Vince Key's magical powers as a team orthopedic surgeon who has repaired my shoulder, you'll see what a man with a repaired shoulder looks like trying to throw a baseball virtually. Because you can't get inside Royal Stadium in order to stay safe. So we're here, and we're hoping someday we can get out there and throw it live. But home opener tonight, the show starts at 6:35. Take a look, see what Stites and Hawkinson look like out there. Let us know what you think compared to Dr. Fauci.
And it was real. It wasn't digitized, even though it's
not
virtual.
at all. Even though it's virtual, that's right. And we actually did throw the ball, and you actually did catch a ball.
Yes.
That's pretty impressive, I have to just say. So welcome this morning. You can tell who's in the studio. We're kind of wound up. We're pretty excited. Dr. Key, welcome here with us. We're going to turn to you for just a moment. First, Hawk.
Yeah.
How do we look?
Not so good. 36, so higher than we talked about, up to where we were last week. We have the weekend coming up, obviously, so let's see what goes on from there. Of those 36, 10 are in the ICU and 5 are on the vents.
Yeah, so it's all about how to stay safe. And Vince Key, you're working so hard in baseball to keep people safe and trying to keep the Royals safe. How's it going out there?
So far, so good. I mean, I think that, thus far we've had obviously a few guys out with coronavirus, but I think we have all of them back except for 2. It has been challenging. You never know when it would hit a player, but that's why we have 60 players on our roster. So if it happens, next man up. We have to treat our players appropriately. All of our players have been really responsible in terms of things that they're doing. So hopefully we keep those numbers down to a minimum.
But with the Miami Marlins, I mean, they kind of that didn't go so well there. Royals seem to be doing great.
Yeah, I think the thing with the Marlins is, though, I mean, those things are going to happen. I think, honestly, it was inevitable. The question's going to be, how do you react to it? And hopefully the Marlins are reacting well. I've heard nothing but good things thus far about what they're doing. And again, 14 guys, maybe 15 guys out. That means they have 45 players still left. But again, hopefully those players are healthy, the ones that are out, and hopefully they can rebound and continue to play baseball.
Yeah, I hope so, because it has been fun to watch. I don't know. Dana, have you been watching it at night?
I've been watching a little bit of that. It's better when the Royals are winning, which they were a few nights ago.
And last night.
And last night. There was a big win a few nights ago.
It was a big win
Lots of runs.
Nights ago. Yeah, it was fun.
And then sporting as well.
Yeah, that didn't go so well last night.
Which was fun, but last night it wasn't so fun.
Yeah, it wasn't.
And then
so
I haven't
good.
watched any of the NBA yet.
Yeah, it is great to have that diversion back on television. So, Vince, tell us a little bit about what are the Royals doing? How are you guys trying to keep the players safe?
I think the big thing that we've done more than anything else is, number one, is education. We've done a really good job between us talking to the players, whether that be myself, Joe Nolan, our internist, has done a phenomenal job of educating these players, talking to these players. Nick Kinney, our head athletic trainer, Jeff Blum, Kyle Turner, Chris DeLucia. We have a whole legion of guys who are talking to these players, educating these players. And the players have done really well in the clubhouse. All the guys have masks on. They're working out. You see occasionally some guys when we were playing our inter-squad games actually wearing masks even though they were competing out on the field. So the guys have done really well in terms of understanding what they need to do to stay on the field. Social distancing, they've really been doing a good job. And really being responsible outside of the K. I mean, to me, and we've told guys, is that I think being inside the K is like being inside the bubble for the NBA. That should be the safest place that these guys are going to be. And again, they've really been very responsible. And, I thank Dayton for his leadership and Mr. Sherman and the ownership crew for doing that. They've done a really, really good job. And the thing is, just like we always say, we care more than other teams. That's just our foundation. And so everyone's done a fantastic job.
That's awesome. And hey, that Brady Singer kid looks pretty special.
He's the truth. Brady has done a remarkable job the last two starts. We have a lot of young talent. The other one is, and he's not on our 60-man roster, the one that's impressed me as well has been Asa Lacy. You guys haven't seen him yet, but I think that guy, along with Brady and Koar and Bubik and Lynch, all these guys, we have pitching now. I think that's the big thing. I don't want to jinx it, but I think, the big picture is we have pitching. And hopefully, hey, Steve, I saw Dr. Fauci's first pitch. That was brutal. I know that you'll be able to throw smoke and not do a little worm burner like Dr. Fauci. God love him.
Well, yeah, bless you for saying that. I want you to see my smoke. Make sure you tune in and watch it. It's right there. It's a heater, at least for what I'm going to throw. That's a heater. And it's all because of your shoulder repair, brother. Thank you. Hey, speaking of people staying in their bubbles, today's kind of a special day for another young man, Anthony. As you guys know, Anthony is part of our program here. He has been working so hard. He keeps his show on track. You'll also remember Anthony had the coronavirus and COVID-19. Anthony is getting married today. He's here this morning working. Yeah. I wish we could get the camera on him or have him come out and take a quick hello and wave to everybody. Come on out here, Anthony. Get out here. Come on, brother. All right, there he is. Anthony's here. Anthony's getting married today. I expect to get a picture back there of you and your family and your bride.
We'll pull one up.
All right. And Anthony, wait, get back in for just a second. Anthony, can everybody hear him? Get in front of a mic. Here you go, right there. I'll lean over here. You got your mask on. Anthony, talk to us a little bit. Are you staying in your bubble when you get married? How's it going?
Yep, going to be staying in my bubble. We just have our immediate family coming to be a part of it. So her mom and dad and my parents and my siblings, her siblings, we're going to be all in our church. Socially distanced. They're making us wear masks. We had to send in a list of guests and all that good stuff. So, yep, things are going on today. So I'm pretty excited.
They are going on. Wow. Congratulations. Yeah. Good luck. I hope you do. I've been married 34 years, and I think it's been great. I don't know what my wife would say, but just good luck to you. And God bless you. Godspeed. Thanks for sharing that with us, and thanks for doing it right in the bubble. So well done, Anthony. All right, Anthony. All right. We have the best crew here. It's a hoot. All right. Let's turn outside. Jill, what questions do we have from media today?
Well, first one is for Dr. Key. Bob says that last time you were on, you were talking about wearing masks. And he has noticed, and you had mentioned you thought the catcher and home plate umpire could wear masks. He's noticed that's not happening with the Royals or their opponents, and he wants to know, is that safe?
All right, Vince. Catcher, umpire, masks. Umpire, masks.
Yeah, I think it is safe. I think the thing is that if you look at where the catcher is actually away, his head is actually turned away from the ump, that he's not getting him breathing directly on him. He may get it breathing in back of his head. And then the other thing is with the mask and the catcher's gear and things of that nature. I think some of the guys have tried it, but I just think the guys are getting a little bit overheated. Now, as opposed to the umps, it's their choice whether or not they want to wear them or not. But I think, relatively speaking, it's safe, and we really haven't had any issues thus far. Knock on wood, with players interacting with umpires or umpires interacting with players that have been COVID. So,
all right,
Yeah.
All right.
it's a hard one.
All right, this one's for you. It's from Mary Lee, and you're going to have to help me with the medical terms. But as a teenager, her tall, skinny son had pleurodesis.
Pleurisy probably, or
For a collapsed lung
pleurodesis.
due to blebs,
Blebs.
B-L-E-B-S.
He had a bleb, and
Bleb.
he had a pleurodesis.
Yes.
Got it. I know what this is. I know what I'm
Okay,
talking
he's a young adult now. He hasn't had any further issues. Is he at further or higher risk for complications of COVID?
Nah.
Mary Lee's from Skidmore.
All right, Skidmore. Hey, Meryl, that's a great question. I bet your son had a pneumothorax and had it, which is a lung collapse, had a bleb. So did I when I was 17 years of age. He had to have pleurodesis done to try and, what a bleb is on the outside of the lung, and your lungs are like balloons, and so if these little imperfections in the lining of the lung, which tend to happen more in tall, skinny people, like me, and what happens is that those blebs are on the outside, and there are little imperfections in the surface, the lining around the lung, and those can rupture. And when they rupture, it's like rupturing a balloon. The lung can collapse and leak. And so if it happens more than once, or if it even happens one time and that there are more blebs or different things, we can do a procedure called pleurodesis, which we go in and we roughen the surface of the lung, and it makes it stick up to the chest wall. And when it sticks up to the chest wall, it's harder for it to collapse. So probably more than anybody wants to know, but that's kind of cool stuff because I'm a lung doctor.
Right.
I don't think there is a risk from COVID in that situation. Pleurodesis are done frequently, as far as I know, and I've had to look into it a bit, both because of what I've done and because I've had a pneumothorax. But what I know is that really shouldn't change your likelihood of a bad outcome from COVID-19 or SARS-CoV-2. It's not going to protect you from anything. I don't think it's going to make it worse, Dana.
Yeah, I would agree. Unless you have some other lung complications, the actual lung tissue is maybe scarred or something of that nature, I wouldn't think just that procedure or that problem back then especially would have an issue right now.
There are people who have a congenital defect in which they have multiple blebs. That would be a different story. So just a few blebs from being tall and skinny, that's pretty common.
All right. Laura's asking, she said she hasn't heard much about blood disorders such as sickle cell anemia and COVID. She said diseases that affect the red blood cells and their ability to deliver oxygen. Is there any greater risk?
That's a great question. And I think that will increase your risk a little bit, only because those red cells, if you get critically ill, tend to not behave very well. So if you do have sickle cell disease and you get COVID and you end up needing oxygen or you needed to be in the ICU, that tends to exacerbate or even can cause a sickle cell crisis. And that's true for other types of blood disorders as well. So I think in that situation, the answer would be that could, depending on the severity of the disease, Dana.
Yeah, I would agree. I did run across a review of some sickle cell patients with COVID some time ago. I don't remember really the outcomes. We've actually had 1 or 2 sickle cell patients here in the hospital with COVID. I don't recall off the top of my head that they had really critical disease, but I think it's certainly one more factor to discuss or to think about when you do have someone who has COVID, along with obviously age. I think that is going to matter a lot as well, depending how old that patient is.
All right. Amy wants to know if the Royals are being tested frequently. How frequently are they being tested?
All right, Vince.
Yeah.
How frequently are the Royals being tested?
Okay, so here's how this goes. It really depends on your tiers. There's tier 1, tier 2, and tier 3. Tier 1 are the players, the medical staff, including myself, and then tier 2 are guys outside of the clubhouse. So It really depends on what tier you're on. So I'll just speak from the tier 1 perspective. Our players are being tested a saliva test every other day. So I have to spit into this little tube every other day. So that's how we're being tested, and that's throughout Major League Baseball. Every team is doing a saliva test and getting tested every other day.
So let's talk about the saliva test for just a minute, because that's a big deal. We spend a lot of time talking about the nasopharyngeal swabs. There's one of the labs here in Kansas City and Lenexa, CRL lab, just clinical reference labs, just got their approval from the FDA for at-home spit testing. Yeah. I know that sounds like a delight. What fun, you get to spit into a tube. Probably better than, easier to do than a nasal swab. It looks like they're almost as sensitive as a swab, perhaps not quite as sensitive, but a great way to do significant screenings, like having to do the screenings of the Royals. We're actually doing a nasal swab every other day. A, painful. B, may begin to get some risks associated with it. But the spit testing, not so much. And I think we're going to do that on the Lawrence campus, Dana, as KU reopens, sort of a mass migration of a lot of people in. We're going to be doing the same kind of spit testing. So let's talk a little bit about that to let our audience know about it.
Yeah, that was a very big deal today on our daily call with the Lawrence campus, of course led by Chris Wilson here. And then they have Jennifer Scrimshire there, and Lawrence's boots on the ground, and a bunch of other people working to help for that mass migration. So we were pretty happy at the news that came down, because it will be a lot easier doing the spit testing, the saliva testing, rather than the nasopharyngeal swab.
Do you think it's going to replace the swab?
I don't think it'll replace it. It's certainly not in the short term. We have enough testing problems as it is. I think it's one more platform that we can use, which I think will be very helpful. But moving forward, we'll have to see. Hopefully this will be one test that can be put out to the masses and put out to the public, so that we can have frequent testing. And if we can get the results back, that's the other key to this, is being able to get the results. We know CRL is really working hard to get us those results in a timely fashion. So that's the other issue as well. We understand that the nasopharyngeal swab, as you said, is the gold standard. But if we can get it from the saliva, from the spit, depending how sensitive it is, it looks fairly sensitive at this point, picking up very few copies of the virus or the genome within the saliva. That will be helpful. And if it doesn't pick it up, does it really mean that you are infectious? That's the other issue to understand. If we aren't able to detect it and you aren't having symptoms, then are you truly at an infectious point too? And that's very important, especially when you have all these young people moving in together into this, into the Lawrence campus, or wherever you may be, such as with a team doing the testing on a regular basis.
And just a special shout out to Chancellor Doug Gerard, who was instrumental in helping us get this thing put together and asking for our help at KU. And I think his leadership has been outstanding at trying to make sure this gets through. The Kansas Board of Regents, Kenny Wilk, as you mentioned here, Lee Norman with KDHE. This is a really big deal, folks. And I think we are pleased to help be a part of that, help lead the way to keep people safe, keep students safe, keep the campus safe. I think when you get this 20,000, 25,000 people all coming into community, we want to keep Lawrence safe. And I think this will go a big way, a long way to helping do that. And I think optimistic it's going to be a game changer.
The nice thing about this is, in general, PCR tests, or these molecular tests, are very sensitive. So it is able to pick up small amounts of the virus if that virus is there.
Yeah, and then once it actually gets pushed into being able to be done at home with rapid turnaround, that's a really big game changer. I think we're still a way away from that, but this is a major step in that direction.
Susan wants to know how the Royals socially distance in their locker area.
All right, I'm going to extend on that. So, Vince, how do the Royals socially distance in the locker room? And also, let's talk about the dugout.
Well, I'll start with the dugout first, because that's a lot easier. There's not a lot of guys. We have a bigger space than what you think in the dugout, because the dugout is actually expanded. Meaning this is that what you see there in the dugout, but you don't see down the stairs. And we have batting cages back there. We have other places for guys to sit that are down the stairs. So it's actually, if you really look at the dugout, it's actually probably 2 to 3 times bigger than what you think. We have markers within the dugouts where guys can sit to make sure that they're socially distancing. So again, what you see on TV probably multiply that by 2 to 3 times, including the batting cage that's underneath the stadium and other places. Some of the guys actually go into the clubhouse themselves between innings. So in the clubhouse itself, again, we're now, expanded the clubhouse in terms of where the lockers are. And we have a huge clubhouse, but in the middle where the guys just usually sit and play cards or do crossword puzzles, we actually have lockers there too. So again, we've expanded and actually modified the locker rooms to make sure that they're socially distancing. Where the chairs are, actually, again, where the physical lockers are. So we have enough space down there to do it. And Jeff Davenport, our clubhouse manager, has done a really good job with his staff to be able to reconfigure the locker room to make it safe for everyone.
And what's the mask wearing policy inside the dugout and the locker room?
Sorry?
What's the mask wearing policy inside the dugout and in the locker room?
Okay, so in the locker room, masks are required. And the guys, again, have been really adherent to that. Actually, one of our players has a family who I guess they had a company who were making masks, and they shipped these masks in for the players to wear. So they have no excuse to say they don't have a mask. And I think some of them have even been monogrammed with their numbers and all this other stuff. In the actual dugout, there's not a requirement, but it's almost inferred that obviously, especially if guys aren't playing, the coaches are a different beast because they're not on the field. They're sitting there in the dugout. That all the guys know, again, we're just trying to be socially responsible here, and also to the safety of our players and to the coaches. Because if we start having a bunch of instances of COVID, hey, it's affecting our game. It's affecting guys wanting to do what they want to do, which is to play baseball. So again, I think it's kind of that unwritten rule that if you're in the dugout that you put the mask on. I know Nick Kinney and his staff there, they have their masks on. So it's kind of one of those things where as one goes, we all go.
Yeah. All right. Well, that sounds great. And by the way, I think those kind of blue headscarves I see Coach Matheny and Coach Eldred wearing, those are kind of cool looking. Are those for sale?
Yeah. Well, they'll probably try to brand them at some point, but Mike is always looking stylish. Trust me.
Jill.
Sean has a follow-up to the mask questions and being stylish and effective. He said there are masks advertised for athletes that are $30 a pop. Yeah. He wants to know, are those more effective, easier to play in, worth the money?
What do you think, Dana?
I think there's a lot of questions there. So first of all, I would say that if you are an athlete or if you're doing sports and activities, we haven't necessarily endorsed wearing the masks outside when you're doing them because they are difficult to breathe. And I would assume these are probably engineered and made so that you can breathe, and they are breathable. The problem is once they get sweaty is an issue. I think that, again, we've always really endorsed simple cotton masks. 2 or 3 layers of cotton is going to be just as effective as some of those other ones as well. I think if you want to be stylish and get it, that's fine. I don't know that there's going to be any studies really against the simple cotton mask versus some of these other ones. So I think either one is really going to be fine if you are unable to get otherwise a surgical mask or anything like that.
All right.
Matthew's wife is a school teacher. She has hypothyroidism, and he's concerned about her going back to school. Is she at greater risk?
Hypothyroidism, I think a lot of that would depend upon the cause and things like that. That's a relatively minor condition. I suppose any medical condition can cause a problem. Is it well managed? Was the cause your hypothyroidism? So probably some more questions to ask. But in general?
In general, if it's well controlled, I would probably say it's not at a higher risk, such as diabetes, obesity,
hypertension, because those things are obviously not controlled at the time.
Right.
Yep.
Allison's 8th grader asked her a question she doesn't know how to answer. She wants help. He says he hears you say that eating at restaurants, going to bars is not safe. How is eating in the lunchroom any different?
Oh, that's a great question.
That's a great question.
And I'm going to say, the problem with the restaurants or the problem with the bar is that you're in close physical contact.
Yeah.
Then you start to drink, and then you start to lose your inhibitions, and then there's a crowd. If you're the only person at the bar, that's fine.
Correct.
There's no problem.
Yep.
Or if you go into a restaurant and there's nobody there, okay, that's not a problem. It's when you get a lot of people in the restaurant and people start getting crowded around each other that it begins to get unsafe. And especially when you're inside, and then the breath clouds are all around you and you're breathing everybody's virus repeatedly, or everybody's air particles repeatedly. And so I think that's what makes it less safe. And I think you just have to think about what the full situation is. So to me, the question about the lunchroom is, can you make it safe?
Yep.
You can make a lunchroom safe. For example, our cafeteria was closed down.
Right.
We totally redid it. And now we have a lot of distance between tables and very few people at a table. So now I would say our cafeteria lunchroom is very safe.
Yeah.
And I would feel very comfortable having a meal down there. But it's because we made it that way. And what I don't know is in a school lunchroom, Dana, if they've made it that way.
Yeah, if you can do that and have the separation. Also, I know that, usually lunch times are 20, 25 minutes when kids are going. So that would still meet the criteria for what we call prolonged exposure. But if you can certainly spread the children out, like you said, our tables, we are making sure that if people do eat together, they are at least 6 feet apart on those tables. So if you can create ways to make it safe for the children to be eating in that area and be spread apart, that's going to be the important thing.
Janet wants to know, why are you not supposed to touch your mask?
Don't touch the mask. Well, we know where those viral particles are.
Yeah, absolutely. So the CDC does say that mostly the virus is spread from person to person in close contact, but it can be spread through fomites or inanimate objects. And we are not a big advocates for people wearing gloves, because it's not really a problem if I am touching surfaces and the virus is on my hands, if I'm doing adequate hand hygiene. But the problem is a lot of people aren't doing frequent hand hygiene as we are able to here. But you can obviously carry your own alcohol gel, hand sanitizer, and do that. But if the virus is on your hands and you are manipulating your mask, there's also chances you're going to be touching your eyes, which is not covered by the mask. But when you are touching the mask, you are contaminating that surface of the mask.
Simone wants to know, how is KU, so I guess it could be us or Lawrence, no, it's us, KU doing to keep patients safe in the hospital from acquired COVID-19?
Oh, great question. We're happy to talk about that because we've worked really hard at this. Every patient, you're supposed to have a mask on. You're supposed to have your goggles on. And so when Dana and I are up on the floor seeing patients, we have our masks, we have our goggles, and we make sure we have great hand hygiene before we go in every room. And we want the patients to have a mask on as well, Dana.
Yep. In addition, that was the biggest thing is, so everybody is having a mask. The patients, the caregivers are also having the eye protection as well. When we can do that, we are also trying to maintain our distance from the patients unless we are examining them or doing specific procedures. So we have all of those systems and protocol in place for all of our healthcare workers, all of our employees to be doing when they have any patient interactions. And again, this is really for patient safety is the utmost importance, as well as our employee safety, and we have kept employees and patients safe.
Vince, how are you all doing that with the clubhouse and with the players? I'm going to bet there's a lot of hand sanitizer out there.
There's a whole lot of hand sanitizer around. We put them in a lot of different places within the clubhouse, in the weight room, in the training room. There's one right outside my office, which is attached to the training room. We have about 3 dispensers down in and around the dugout. So we've placed them in a whole lot of areas within Kauffman Stadium. So we've been planning this for a long time. I mean, we actually started looking at all this back in March. Once we had the shutdown. So we've done a lot of planning, and I think it's been really good, and it's actually borne out that we've had them in spots where players are really adhering to it.
Yeah, that's important. And Vince, one thing we should probably talk a little bit is about mask wearing, because we know that some people are still reluctant to wear a mask. And we know that surgeons always wear a mask whenever they're in the operating room. Would you feel comfortable doing a surgery on a patient without a mask on?
No chance. No chance. And I know it's tough for folks who don't wear it all the time. Their face feels claustrophobic. I mean, even when I was a medical student that I had to start wearing a mask in the operating room on different surgery rotations and whatnot, it was weird. And I just got used to it. And it's hard for the public to really get used to it. And I understand that. But it's necessary, and it's something that we have to be comfortable with being uncomfortable. And being uncomfortable is putting this thing on and wearing it. So it's not only for the safety of yourself, but it's always for the safety of others.
Hey, dude, when you were a medical student, that was really a long time ago. Do you still remember that far back?
I mean, we were operating with flint stones and stuff like that. But yeah, I do remember it. It was a lot of fun.
Flintstones, meet the Flintstones.
And I'm hoping that all of the, people, just one more way to get the message out, seeing these sports stars wear the mask and seeing celebrities wear the mask, just one more avenue to get the message out and continue to endorse that message.
And what we keep trying to say on this program is that mask wearing, it's not a political issue. It's the science. Yeah. It's how we keep each other safe. And, it's kind of like just the basic part of life to help keep other people safe. It's part of our responsibility. We are our brother's keeper. And so in this instance, the way we do that is to wear a mask. It keeps ourselves safe. It keeps the rest of the folks safe, just like it's been keeping staff and especially patients safe in the operating room for many generations.
And it may be the way we get back into the stadium, into Arrowhead, into Kauffman, if everybody is doing that and we can see a decline in our case rate, in our hospitalization rate, in our death rate.
And isn't that important? And I am ready to get back to Arrowhead Stadium just as soon as we can. Let's go, Chiefs. Next question, Jill.
Yeah. Okay. So Jennifer is a teacher, and she's at odds with her parents who just want to send the kids to school in a face shield. Yeah. She wants to know, is that going to be good enough?
Not a face shield, no.
That has been somewhat proposed. Right now, there's really no data to suggest that is going to be an adequate barrier compared to the mask. I think moving forward, that can be something that can be looked at. But the best thing that we know about is if the children and the teachers and staff are masked.
And actually, there's been some research to demonstrate that a face shield may redirect the flow, but doesn't catch the flow. One of the things that masks do is it actually traps some of the viral particles. The mask, what happens is it hits the front of the mask and then drops. It can still go down depending on what happens there, what kind of interaction you're having. You're the teacher, you got a mask on, or one kid's tall, another kid's short. Okay, you're just directing it right to them. It's like a funnel going right at them, so probably not as effective.
Sounds like a freezer demonstration to me.
I think it will be.
All right. Cliff has a question. He wants to know, what are the Royals going to do to keep from what happened with the Marlins happening with their club?
Okay, kind of we talked about that at the very beginning, Vince, but what can the Royals do to make sure that what happened in Miami doesn't happen with Kansas City?
I think, again, the biggest part is just being responsible. A lot of the guys here in town who have families, actually their families aren't in town. I mean, they've sat their families back home in their home state. So there's not a lot of players who actually live in Kansas City. So a lot of them who have families are kind of batching it while they're here. So I think that's one. They understand that they can't gather together and have dinner together, which kind of sucks. But again, it's one of those things where the carrot that's being dangled in front of them is, hey, you guys get to continue to play and play the game you love, and earn a living for your family. So it's just being responsible and being held accountable, not only to themselves but to their teammates, to the organization, to Kansas City in general. And I think those are the big things that hopefully encourages them, and hopefully we won't have a big number of cases like they did in Florida. But again, you have to understand the other part is where is Miami? Miami's in Florida. They've been having a large outbreak in the number of cases and things of that point. So again, it all has to also do with where you live.
Some of the greatest density per population number of cases and rapid increases are occurring in Florida. So that's clearly true. The KDHE, unfortunately, it's high in Kansas as well, very high in Missouri as well. I mean, Kansas and Missouri kind of neck and neck on that one, not a race you want to be in. And but Florida is higher, and so that may indeed add to the part of the challenge.
Several viewers are on blood thinners, different ones from heparin to aspirin. They want to know if they are at greater risk.
Well, that's an interesting question,
like that
Dana.
question.
Are they at greater risk,
Yeah.
or may they actually be a little protected?
I would assume, knowing what we know about what this virus does and the propensity to cause endothelial or blood vessel damage, as well as hypercoagulable, meaning you can create blood clots a lot in your body after this virus, they may be actually protected from some of those blood clotting complications, such as blood clots in your lungs and in other arteries as well.
One of the challenges, though, will be that there's a reason you're on a blood thinner,
Right.
and the reason you're on the blood thinner is probably not going to help you, because I can't think of a lot of good reasons to be on blood thinners. Now, aspirin may be a little bit different because, there's some data out there, especially with men more than women, that suggests aspirin use may help prevent heart attacks and strokes. But so if you're taking it as what we would call primary prevention, that might be different. But the real question is, what's the risk factor that's causing you to be on blood thinner?
Yeah, I would agree.
And we have a few people that are asking about the new studies that are being talked about in the news around kids and also about T cells. Could you just kind of give a quick, they want to know your opinion.
All right, kids and T cells.
Okay, so for the children, I like the study. It is consistent with what we talked about earlier in the week or even last week about, okay, there's indirect evidence that children may spread it less than adults, especially if you're looking at 10 years and younger. But what we also talked about was there was another study that did show that children seem to have the same amount of viral load or the same amount of viral particles in their saliva or their upper respiratory tract as adults. So it was really hard to understand exactly why they spread it less. This paper, again, just shows that they is another piece of data showing that they really have the same amount of viral loads as adults do. So again, I think that's one question that continues to need to be answered and examined and looked at. But it would be consistent with the other data that we talked about showing that children seem to have the same amount of viral loads in their upper respiratory tract as adults. As far as the T cell
Especially with
immunity,
any virus, including the coronavirus, it's not unique to this virus. That's true about
Right.
influenza and other rhinovirus, all the viruses.
and that was our point is, if they spread it less, that's actually unique to this virus because we understand that children spread viruses a lot easier and a lot more than adults do. Influenza, cough and cold viruses like you talked about, diarrhea or GI illnesses.
But there are some viruses children don't spread, and tuberculosis, not a virus, bacteria, of course,
Yeah.
but the children don't seem to spread some things. And so it is interesting, and we don't really know about it yet.
Yep, I think we just continue to look at it, look at all these studies, make sure they're validated and the data is good, and kind of go from there.
Some things may be different with how they spread or with what's being spread in terms of the virus and how it's activated or not activated.
Yeah,
It's just different.
And some of that is thought to be maybe the children's physiology. Do they not have the amount of the receptors in the body, the ACE2 receptor and the other co-receptors as well? So I think we still need to kind of get that information.
Lots to learn. All right.
And
Go
the
ahead,
T cells. So the T cells is interesting too. There was a paper a couple months ago who showed that some people have some T cell recognition of the virus even though they've never been exposed to SARS-CoV-2. I think it's interesting and unique. There's a good group out of New York City who works with common coronaviruses, endemic coronaviruses, the ones that cause the common cough and cold. And they showed that up to 90% of people in that area have had contact with the normal coronaviruses. But we know the devastation that underwent New York. So it's really interesting to see, is there some cross-reactivity? And that's the big key word here, cross-reactivity of a normal common coronavirus with SARS-CoV-2. This study would suggest that there is. What is that cross-reactivity? Are there some pieces of the virus that are constant throughout all of these coronaviruses that maybe they recognize? I don't know that clinically it's too impressive or important, but you could say, well, maybe that's why some people are asymptomatic or not. I think that's an interesting find, and we still need to kind of look at that as well. Figure out why are some people asymptomatic or have mild disease and others don't. Is this T-cell cross-reactivity a component? It's really hard to say right now, but it is another piece of data combined with the other previous publication that shows that maybe there is some cross-reactivity. Again, I don't know how clinically significant it is.
It's once again, we'll know more in 2 weeks and 2 weeks thereafter.
Exactly.
And my other cool statement is, while we may have more parts on it, we're still building the airplane while we fly it. Time for one more question.
Corey wants to know, with the current infection load, are you still going to send your kids to school? In the community.
We just had to make our decision on in-person learning versus distance learning. I did pick in-person learning as well as using the bus. That's how it is currently. If the school and the school district continues to be open, yes, I am sending my children to school.
All right. So Vince, final thoughts today. Big game tonight at the K. Some squirrely, thin, tall guy is going to be throwing out a first pitch, and some redheaded guy is going to be making the first catch. So
that's right.
We have to hope that things look better than Fauci. We want votes tonight. You can check it out at 6:35 tonight and see it for yourself.
You may need a card after this.
I'm going to peek out there and watch. I think the big thing is, again, throw. But then again, I had a physician, it was probably about 7 years ago, get smacked with he tried to catch it and it didn't work out too well. So as long as the pitcher is throwing straight and the catcher is paying attention and catching it, then everything will be safe. Again, I'm happy. Chris Bubik is pitching for us tonight. He's another one of our young guns. And like I said, I said before, we've got these young pitchers that I think are really going to make an impact. And it's not like the pitchers that we've had in the past have not been very good. I mean, we still have Danny Duffy pitching well. We still have some of our other guys, Ian Kennedy, some of these guys. We got Greg Holland back, which I love. But I think these young guys are really going to make an impact on this club. And now we got some guys who can hit the baseball. Salvy's come back in a vengeance, coming back. And I am so happy. He's kind of like my child, literally. I'm so proud of him and what he's done. Soler thumps. He does. The kid that we got, Cordero, you may want to YouTube this 489-foot bomb that he hit. So we've got some thumpers, and we've got the speed with Mondi and some of the other guys. One of the new guys, Nick Heath, he's from Junction City. It's funny, his mom and I were teammates at K-State on the track team. So we've got a lot of young talent. We just need for it to all come together, and we get ready to make another run.
Not that you're a fan or anything like that,
Right.
brother.
Wow.
Well done.
That's a lot of excitement.
That is a lot of excitement.
That's
Final
why he
thoughts?
loves doing what he's doing.
It is. That's why he's great at it. Final thoughts today?
Yeah. Stay in, stay home this weekend. Watch the Royals. If you do go out only if you need to. Wear your masks. Don't congregate indoors or in large groups. And everybody be safe, because we know that the numbers are going up. If we can continue to do what we've been talking about, hopefully those numbers will go down and we can get back to the stadiums and see our sports teams in person.
Today is the day for celebration. We're celebrating the Royals being back. We're celebrating Anthony and Phyllis as they get married today. Wish them the best together. Congratulations, and they're doing it right as they socially distant at a wedding. Of course, I don't think the two of them are going to socially distance, which is probably appropriate. Yes. But congratulations, and Anthony does a great job here in the studio. Bright young man. We just keep up the good work there, brother. And then to all of our listening audience, we've got some pretty good mask things that are going to pop up here in just a minute. A quick word about early next week. I'll be out for a couple of days, but on Monday, we have the chief medical officers with Dr. Hawkinson as well, and Jessica Lavelle will be here in the studio, and they'll be talking about race and equity and things that are going on around the coronavirus with the CMO from Truman, Liberty, and Advent Health. They're back with us. They're a great group of folks, and I think you'll enjoy hearing from them. A couple of last-minute notes on some of our cool mask pictures today. Linda and Shirley are out doing some blueberry picking. They look awesome in their masks, and I love blueberries.
The blueberries look
hey,
good.
Linda and Shirley, if y'all ever want to share those blueberries, I'm all about that. And here's Jules riding Cooper. They like to socially distance together. And that looks great, too. Thank you all for sending in those mask pictures. We love those. And there's a note on the screen about where to send them. We love the stories about mask wearing and socially distancing. In fact, socially distancing will be on display tonight as Hawk and I will be out there virtually throwing out the first pitch at the Royals home opener. It starts at 6:35. We invite you to join. You'll have to compare us to Fauci. Let us know what you think. And in the meantime, we've had some fun today, but in the meantime, coronavirus is serious. But we can get through this. We can get through it together. And it's just great to have the Royals and Sporting and the NBA back together. We're hoping for the Chiefs as well. But doing it together is what it's about, because we keep each other safe. When we keep each other safe, we keep each other alive. When we keep each other alive, we're here for another day. And pretty soon, it's going to be back to normal. Just like pretty soon, we hope to be back at the K and back to Arrowhead. So stay safe. Remember, there's still no place like home.